Dhirendra Singh for this opportunity. Uh, so the topic that was given was to discuss about what are the opportunities that exist for telehealth and mHealth programs in India and surrounding countries in South Asia, and how is it that industry can participate in actually making this a reality. So we representing the industry. Just to give a brief background of BPL Medical, BPL has been a complete Indian-born company. We are about 51 years old as we speak today. It was founded in 1963 by Mr. TPG Nambiar. BPL has always believed, heart in heart, that there is a scope for innovation. There is no dearth for talent. I think a lot of speakers in the morning have kind of highlighted that. And today, if you actually look at medical technology, e-health or mHealth based technologies that are available, still most R&D work and manufacturing work actually happens either in China or Taiwan, and it used to generally happen in the US and Japan before. So however, we are happy to say that there are Indian companies now that are taking R&D work, local manufacturing very seriously. Of course, with Mr. Modi's speech around Make in India campaign and Digital India, I think the industry will be receiving all the required support to make India the hub for medical technology. So here I am to kind of represent what we have currently as an industry in the area of telehealth and mHealth. Before BPL actually took telehealth and mHealth into its product development life cycle, so we actually looked at certain data that was gathered by leading research organizations like Frost & Sullivan, McKinsey, to see what is the scope of getting into mHealth business in India or in surrounding countries. So it all began with actually understanding the burden of disease. I think no wonder this is a data that's known to, I think, every medical or paramedical person sitting here, that there is always a constant rise in the chronic or lifestyle diseases, and data is up there in 30 years between 1990 and 2020. So there's going to be a many-fold increase. That's very much there. So, however, with that being said, there is also a rising, importance towards connected healthcare. So today you see that there are patients with rising incomes. There is increased insurance coverage. We also saw about how IT plays a critical role in actually intelligent insurance coverage, etc. In the afternoons, the pre-lunch sessions. So therefore, there is a need for the healthcare from a B2B. What used to be typically that, okay, doctor is God, whatever doctor says is kind of perfect, and I'm not going to challenge it. I think those days are gone. So today, more and more patients are behaving like consumers. So healthcare is actually going the B2C way. It's healthcare consumerism. So therefore, there are need for mHealth technologies that help make that happen. And I completely agree with Dr. Bhattacharya in his initial speech that he was saying, patient need not have to travel anymore. Doctor need not have to travel anymore. Possibly a frontline Anganwadi worker or a primary healthcare worker may have to travel. But what technology is currently available in India, made in India by Indian companies that can make this happen? So that's the topic I'd like to touch. So this is a very crowded slide. I wouldn't read everything. It's a Frost & Sullivan study. We're quite recent. It was actually done in 2012. I will just highlight the two things that are in the boxes there. Okay. So the trend, which is now already begun, starting about 2010 onwards, is that now patients actually want to be able to self-manage disease. That's the trend, and this is a very grounds up qualitative research that has been done with over 10,000 patient interviews being conducted by Frost & Sullivan. So very qualitative ground level data. So patients are actually in India wanting to be able to self-manage disease. They are actually very open to the idea of having remote consultations and remote health monitoring done, provided they have technologies in their hand that enable them to do so. Self-testing, early treatment and management, going back to Dr. Bhattacharya, so moving from therapeutic healthcare towards preventive healthcare, if there was a simple, affordable, good quality technology that could be made available in the hands. Okay. Second, I think the overall from a delivery perspective, so we have we have the very large institutions like Vadia Institution represented here, large corporate hospital represented here, who've been front runners in actually healthcare delivery. Now, healthcare delivery is also looking at how healthcare delivery can be patient-centric. So that is something that I think is very much shown up in all our research studies, which are published research studies from these organizations. So that being said, it is also important for us to know as an industry what is the right time to put in effort and money in developing this technology. So there is a certain adoption curve that each of these technologies take. If you clearly see, I will just pinpoint it to here, this graph here. You can see all those technologies that are currently available today are actually represented this way, whereas technologies that have an early adoption preference of less than 2 years are represented in that particular color. So where we are currently playing is basically mobile health monitoring. So all of us know what happened to remote ICU, tele-ICU type of thing, still early stages, but definitely studies says that the time is now ripe and right to actually introduce mHealth in India, and most of these are very India. This is a very surprising, it's a McKinsey report. This report was published again in 2009, not very long ago, not very fresh though, but still if you see, India, this is the Indian data, as you can see. In India, we have taken both rural and urban divide here, and not really too much of a difference. India is actually comes up, in fact, better than the United States in terms of healthcare consumerism adoption. So this basically tells that Indian customers are now, it's possibly one of the skew to this data could have been the very quantum of population that we have considered to emerging markets. That skew definitely exists in this data. But however, it's a very healthy trend to see that Indians are now more informed than before, thanks to the digital revolution. So we seek information on the net. We seek information about new healthcare technologies that can transform mobile healthcare, and that is very encouraging to see. Now, okay, so now we know Indian customers like mHealth and they'd like to adopt it. But for any business to be viable, customers should also pay for it, correct? So therefore, the same study also looked at, are Indian consumers or patients willing to pay for mobile healthcare? Absolutely yes, they are. And the study also very clearly indicated how much are they willing to pay. So this is like a pricing analysis for us, which looks at the viability of the business model, the viability of business of getting into mobile healthcare itself. Very clearly it shows that the Indians are willing to pay for technology, whether it comes to buying of a device, as long as it is not too expensive, good quality, and they're willing to use that device and ask consultation from their doctor, and even willing to pay a nominal consultation fee for it. So that is what the study revealed. Now, therefore, all of this led to BPL Medical actually looking at mHealth very seriously, and very happy to say that we had the fortune of partnering with a globally acknowledged IT major, Intel Corporation, to develop this mHealth product, completely grounds up in India, made in India for Indian use and global use. The product is now a reality, launched in the market, available. If you actually look at the scope for mHealth, so this is again data from PricewaterhouseCoopers, 2012 February published, clearly shows that the Indian healthcare market, if you see the right graph here, it is actually 0.6 billion US dollars. So close to about 3,200 crores is the size of the Indian mHealth market. Very fragmented, not an organized sector as yet, but definitely tells about the huge opportunity, business opportunity that exists. And as the previous speaker was also mentioning, it definitely has a huge opportunity in cardio-diabetic screening. I really like what Public Health Foundation of India has been doing. So therefore, the tool that I'm going to be presenting, rather two tools that I'm going to be presenting, is something that will actually help in early screening of cardio-diabetic diseases amongst patients at a home setting. And another technology, which is, I go back to the Tamil Nadu example, where they have a STEMI project, where we have a technology which actually can diagnose an acute myocardial event at the point of pickup of a patient, where it can save lives within the golden hour without losing time of shifting the patient to the hospital, and many times the ambulance gets stuck in a traffic jam. So that's the technology we're going to show. So it has cardiovascular, diabetes application, most importantly, post-operative or post-intervention patient management, geriatric, aging population management, lifestyle-related diseases, emergency, public health, and preventive health screenings. These are the various areas in which mHealth technologies have this one. So naturally, as a responsible mHealth company, the company needs to have an established sales and service distribution network. We should have a local, strong manufacturing facility that conform to all the required manufacturing guidelines and regulatory compliances. And we as a technology company meet all of them. So we are CE certified facilities. We have the ISO 9001 and 13485 certified facilities for that. And of course, we looked at the complete validation of this. we've been through a specific process of developing this technology. So basically, we looked at the clinical validation. So I will show you the clinical validation data of this as well. And therefore, I present the first product that we developed completely in-house in India and now selling in several South Asian, Southeast Asian, Middle Eastern, and African markets, which is a LifeOne product, which is this is a handheld wellness monitoring device. This is a screening device. Okay, what it basically does is it does a complete 12 lead ECG. Most importantly, without the need for gels or leads. I'm sorry, I think the projection is not completely coming up there, but I will still read. Complete 12 lead ECG without the need for cables, without the need for gels. Second, once you have taken the ECG, it actually connects to a cloud. So we have an Intel Amazon based cloud where the complete medical record is maintained, and through the cloud you can actually connect to your doctor of preference. The doctor could be in the hospital, or just in case the doctor is unavailable, there is also a 24/7 medical call center facility that's available, which is manned by MD physicians, which provide 24/7 medical consultation services. Most importantly, since it's a medical record we are referring to, patient data privacy is of utmost importance and concern. We have ensured that the cloud has complete privacy and security built into it, very similar to the VeriSign level of security that we have on net banking. So that is something we have ensured. And since most cardiovascular patients, when they assess their ECG, are also prescribed by their doctors to follow a strict diet and physical activity regimen, we also have included a pedometer in it, so that the patient, after taking an ECG, can also share his physical activity records with his doctor, where the doctor can actually consult basis what is the level of wellness the patient has. What we also found when we were developing this device is that most cardiology or heart patients had uncontrolled diabetes as well. So that is why what we have now done is we have included a glucometer as well into this technology. So this small handheld device, so you can see, I will just show you the form factor of this, which you saw in the previous slide. It's actually a small handheld device, which actually is of this size, small pocket size. This now has an inbuilt 12 lead ECG with a glucometer and a pedometer in it, where a patient in a matter of 40 seconds takes a 12 lead ECG, 10 seconds he takes a blood glucose, immediately connects through a smartphone device. You can see here the smart device captures the ECG pattern, captures the glucose pattern and the physical activity pattern, connects to the Amazon cloud, and immediately sends this data on the cloud to the doctor for an instant consultation or an advisory. So this is what we have done with 4 easy steps to take an ECG. So lead 1, lead 2, lead 3 up to AVR, AVL, AVF, V1 to V6, complete 12 leads disclosed in 40 seconds flat. And this is the quality of the ECG that comes out of the technology. And one of the important questions that came, to develop new technologies is, do you have you clinically validated them? Very important that whenever we develop a new technology, it needs to be compared to conventional technologies. We have done a 1,000+ patient study at Kasturba Medical College, where it has been looked at several of these, including ST elevation MI patients, unstable angina, tachycardia, bradycardia, bundle branch, left and right bundle branch block patients. All of these clinical conditions have been tested out, and there is a 94% clinical accuracy with a conventional ECG. So and it's statistically significant, which actually shows that it's very easy for patient to now take an ECG through the mobile app, actually transmit it to a specialist and receive a consultation without the doctor need to travel to a peripheral center or a rural center, without the patient needing to travel into a major city to seek consultation from a doctor. So this being said, we also have very reputed and renowned clinicians in the country that have been using this. Dr. Ramesh from Vivus Heart Center, Bangalore, Kasturba Medical College, Dr. Raviraj, and very recently Narayana Hridayalaya Hospitals under leadership Dr. Devi Shetty, Apollo Home Care in Hyderabad under leadership of Dr. Mahesh Joshi, and now recently in Delhi we have started our working relationship with Max Healthcare through her MHealth program, which is the educational program for rural healthcare. So that's the piece we've been doing on the screening side with LifeOne for ECG, glucose, and physical activity. Now, someone actually came up to us and said, "This is great. This is for great tool for screening. What if if we could have a technology which can actually save lives if the patient is getting into an acute heart attack?" Yes, we looked at that as well. So here we have technology which actually helps diagnose an acute heart attack in 60 seconds flat. So I remember Dr. Ravi Babu actually mentioning about the STEMI program that they have in Tamil Nadu. So here is a US FDA and CE approved technology which can be used on any ambulance, which can be used on an airline as well. So we have seen this in Hollywood movies, I think. So patient develops a heart attack. So there is an opportunity now to actually put a glove kind of a technology. I'll just show you on the next slide. This is how it actually looks. You can see this is a glove. You actually insert your hand into the glove. The glove connects to a small recorder box. This recorder box has a complete 12 lead ECG data acquisition, plus it has a voice recorder in it, and it is Wi-Fi enabled. Okay. What it does is, naturally the patient is sweating, is in distress. You would just apply the glove on the chest. It acquires a complete 60-second diagnostic quality 12 lead ECG. The person who's acquiring the ECG can also talk to the device and say, here is a patient so and so years old, and he looks pale, whether he's anemic, whether he looks pale, whether he's having any other symptom, what is his physical condition, can actually be spoken over the device, and through the entire data, including the voice data, gets transmitted to a Wi-Fi or a 2G or a 3G connection to the nearest acute care hospital, and the doctor can immediately make a diagnosis of whether it's an acute cardiac event or it's of a non-cardiac origin, and the clinical measures or the treatment measure can be instituted then and there by the paramedical staff, trained paramedical staff, stabilize the patient, and then take the patient back to the hospital. So this is how the form factor is, small handheld, this is FDA approved as well. So it has USB connector, everything that's coming in, which is something we have developed in partnership with the US firm. And as again, so very important that it comes with a cloud solution as well, with high-end connectivity and IT features. So that way, with very simple technologies that are available today, either for primary healthcare screening or for acute coronary care screening, mHealth, I'm sure, is set to stay and is set to make leading progress in this. I would just conclude my talk by saying what could be the direction in which mHealth and technology may be moving. We clearly see that there could be 3 business models that may emerge in connected devices or mHealth ecosystem. One is the over the top, where mHealth provider actually transmits data over existing network, which is something that we have already today. Second, definitely is a strong ICT partnership. And thirdly, you never know, in the very near future, we may have actually mobile companies. It could be mobile handset companies like the Samsungs or the iPhones, or even mobile telephony service providers, could be the Airtels, the Vodafones of the world, may actually get into the mHealth space as value-added services. That's something that we envisage that may happen in the coming future. So that's kind of a new world vision where, going back to Dr. Bhattacharya, doctor need not have to travel anymore. Patient need not have to travel anymore. There is technology available that keeps both of them connected at all times. So thanks for a patient for listening. Thank you very much.